Good afternoon. This is Dr. Lorna Heilig coming to you once again. Today, I want to talk with you about dietary fiber, specifically what you should know about dietary fiber. What is dietary fiber? Dietary fiber comprises of portions of plant-based foods that are indigestible to human digestive enzymes. Therefore, they pass through the digestive tract intact. They're not broken down. Dietary fiber is an important component of our overall healthy diet and is thereby supportive of several of our bodily functions. Now, what is the real issue then regarding dietary fiber? Studies of estimated intakes have suggested that people in the United States generally consume less than 50% of the daily recommended dietary fiber intake. Now, there are two major types of dietary fiber. Many of the plant foods that we consume contain a mixture of these two types of fiber, soluble fiber and insoluble fiber. Soluble fibers include things such as plant pectins and gums, and as the name suggests, these are soluble in water and dissolve or are partially dissolved in water. Insoluble fibers, such as cellulose and hemicellulose, are not soluble and remain intact. Now, what is the mechanism of action of these dietary fibers? Soluble fiber is able to achieve its effects by forming a gel-like constituency as it absorbs and it dissolves in water. Insoluble fiber, on the other hand, attracts or has an affinity for water, thereby it traps water molecules. What are the benefits then of soluble and insoluble fiber? Soluble fiber is known to help improve digestion. It also binds lipids from the diet, thereby reducing blood cholesterol levels by lowering low-density lipoprotein. Therefore, this is known as a hypolipidemic or hypocholesterolemic effect of soluble fiber. Similarly, soluble fibers are known to bind sugars, thereby reducing blood sugar, having a hypoglycemic effect. As a result of this hypoglycemic effect, it is known to have control of blood sugar. And it is also implicated in helping to reduce risks of developing type 2 diabetes. As a result of a fullness that occurs as a result of consuming soluble fibers, this is also very helpful in weight management efforts as well. Insoluble fibers are known to promote health and regularity of the bowels. They contribute towards softer stools and are known to lower the risk of colon cancer, help in the prevention of hemorrhoids, and adequate dietary fiber is also associated with control of hypertension and lowering the risk of breast cancer. So then, where do we get rich sources of fiber? As I mentioned earlier, fiber intake may be increased by consuming a variety of plant-based foods. Examples would be vegetables, fruits, whole grains, legumes. However, there are some foods that are high fiber in content, and I have presented a number of them in the accompanying diagram. How much of fiber is recommended on a daily basis? Now, for men aged 50 years and under, the recommendation is for 38 grams of dietary fiber daily. For men over age 50 years old, 30 grams of dietary fiber is recommended. For women aged 50 years and under, 25 grams of dietary fiber is recommended on a daily basis. And for women over age 50, it is recommended that they should consume at least 21 grams of dietary fiber on a daily basis. Now, one may ask the question, there it is, we have results of studies that suggest that many Americans are not consuming half of the recommended amounts. However, there are those who actually go over the amounts. So one may ask the question, how much is too much? There are no tolerable upper limits that are set for fiber. However, intakes of 50 grams or more may be associated with discomfort such as abdominal pain, bloating, and gas. It's also important to note that as you increase the fiber intake, it's important to make sure that you are drinking adequate quantities of water on a daily basis. And generally, it's recommended that we consume, adults, at least 8 to 9 8-ounce cups or glasses of water on a daily basis. Should you like to discuss any of the points that were discussed today with me or to obtain further information, I can be reached at my blog, Let's Talk Health and Nutrition with Dr. H, at https://www.letstalkhealthandnutritionwithdrh.com. I look forward to chatting with you very soon.